In many ways, 2023, in terms of health at least, was the year of Ozempic. Initially found to be useful for patients with diabetes as a way to manage blood sugar levels, and it was an injection. But it had an off-label use where it can have this indirect impact on weight loss. It mimics GLP-1, which is a naturally occurring hormone that could monitor and lower blood sugar over an extended period of time, but it also had this indirect benefit of weight loss, and people have been scrambling to use Ozempic, even if you don't have diabetes. We talked about how Ozempic was going to start this black market frenzy of Ozempic alternatives. You take it and you pretty much just never feel hungry, and you can lose a stack of weight just because it's an appetite suppressant. That has led to a rage of influencers talking about it, and therefore massive global shortages in Ozempic. And I saw on the latest Oscars broadcast, the host was making a joke and he was saying, "Oh, you all look great, the Ozempic and the plastic surgery must be working." So it's really cut through.
Yeah.
Shortage has led to people looking for Ozempic and maybe paying black market prices for Ozempic. I'm not really sure.
I don't know.
The TGA has issued a safety alert after pharmacies who can make these drugs compound and essentially do a non-commercially branded version of Ozempic. They're using loopholes to make Ozempic replicas, and people are able to access the molecular equivalent of Ozempics at these compounding pharmacies. Hundreds of Australians are buying compounded versions of Ozempic for weight loss, and these compounding pharmacies are producing replicas and shipping them to customers around Australia. The regulators have indeed issued warnings. Still, the patients think it's a good outcome. Compounding medicines in Australia is intended to help pharmacists give individual patients access to medication that is in shortage or not available, and it is exempt from normal regulatory approval processes. This exemption actually is not intended to supply drugs on a mass scale due to high demand, and I'm pretty sure this loophole will be closed in the near future, especially as Ozempic is expected to remain in short supply until December 2024 in Australia, full calendar year from the point that I'm recording the podcast. The TGA is really warning consumers that these compounded semaglutide drugs have not been assessed for safety, quality, and efficacy, and this trend, they're going to start clamping down on this loophole that is unclosed for the time being. But what happens when these compounding pharmacies make a drug that isn't to the same standard and a patient gets sick or they get very, very ill or die from taking the drug? Who is liable in that situation? Well, the TGA warns that it could land pharmacists, in particular in hot water, because the compounding exemption in the Therapeutics Good Regulation does not apply if a pharmacist is compounding products for bulk supply in anticipation of a patient's need. Pharmacists may be exposed to liability if the patient has a negative outcome, especially if a TGA-approved product is available to treat the patient's medical condition. So not only is it buyer beware, it is pharmacist and practitioner beware. You do not want to land in hot water over something like this. If there's one thing I want you to take away from all of the headlines that we'll talk about today, you got to follow the money. The reason that these loopholes are being taken advantage of and that compounding pharmacies are mass producing a black market Ozempic is because there is a demand for it. If there's no demand for it, then science and tech very rarely gets off the ground. Innovation for innovation's sake very rarely makes an impact on our everyday lives, and all of these stories have that in common. And this holds true to the very origin of treatment of weight loss and treatment of diabetes. If you look at the initial discovery of insulin, the first treatment that changed how diabetes is considered and viewed by people in the medical community. Insulin was discovered by Sir Frederick G. Banting, Charles H. Best, and J.J.R. McLeod. This is an interesting article linked from Diabetes UK. It goes through the history of how they actually made that scientific discovery. But what I really want you to pay attention to is what happened at the end of the story. After insulin was discovered, it started to be mass-produced in 1922, 1923. On the 23rd of January 1923, Banting, Collip, and Best were awarded US patents on insulin and the method to make it. They sold these patents to the University of Toronto for $1 each. In case you're wondering, that's very, very cheap, even accounting for inflation. That is still a tremendous discount because they believed insulin does not belong to me, it belongs to the world. And because of these very cheap patents, insulin starts to be produced at a mass scale very, very cheaply. Eli Lilly became the first manufacturer to mass produce insulin, and they began shipping the first commercial supply of insulin. I'm not sure if the University of Toronto licensed that patent for also $1. I'm guessing University of Toronto took a cut of that commercial windfall. What that did mean is these scientists won a Nobel Prize in Physiology of Medicine in 1923. 2023. Sounds like a feel-good story, right? Not until you read the next story from the conversation, The Discovery of Insulin, a story of monstrous egos and toxic rivalries. When Frederick Banting's phone rang one morning in October 1923, it was the call that every scientist must dream of receiving. An excited friend asked him if he'd seen the morning newspapers, and a friend told him that Banting had just been awarded a Nobel Prize for his discovery of insulin. Banting told his friend to go to hell and slammed the receiver down. He had been awarded the Nobel Prize, but so too had his boss, John McLeod, and this is a tale of monstrous egos, toxic career rivalries, and injustices. So these people who made the discovery hated each other and hated that the other person got more credit or got equal credit. Sounds like a huge expose. When I read this headline, my first instinct was, duh, of course. Scientists are filled with ego, especially scientists operating the highest tier of innovation. Doesn't always have to be this way, but it all too often is. I'll save you the hit-by-hit, blow-by-blow gory details of their inter-academic tensions and toxicity, but a few highlights if you like. In 1921, Banting and Best were working in a laboratory making pancreatic extracts, testing their effects on the blood sugar levels of diabetic dogs. Really grating work. McLeod was away in the summer, and McLeod was a bit of a jerk about it. He says, look, your results are not great. There's no appropriate controls. They could not agree on more lab space, and the university wasn't playing ball, wasn't giving him the resources he wanted. He stormed out, he raged, threatened to leave. Again, very common. And they tried to present their work in public at a formal scientific conference. The presentation was a disaster. Banting's presentation was overawed, and he did not present it well, and McLeod stepped in at the last minute to give the presentation. This is another reason why soft skills is really important in science. The most rigorous, brilliant scientist in the laboratory doing the experiment, if you can't present it well, if you don't have a good sales department, if you don't know how to talk about your work in a relatable way, no one will connect the discovery to you unless you've got receipts. And indeed, this case, Banting did have receipts. He was named on the Nobel Prize after all. So it's not a total disregard for his contributions. And it would appear from the record books that McLeod was a bit better at these soft skills of communication. When he stepped in, took over the presentation, Banting thought this was a coup. McLeod was trying to rob him of the credit and to rub salt into the wound that happened in front of the most eminent doctors in the field, and Banting thought insulin was slipping from his grasp. So this is just a small insight into just how poisonous these kinds of working relationships can be. You don't have to have a perfect working relationship to be very productive. Shaq and Kobe, if you're an NBA fan, had one of the most toxic professional relationships ever. They were very productive on the court, winning 3 championships together, but this is also very common in science. They were obsessed with legacy, and they weren't happy sharing the Nobel Prize, and Banting was upset and furious that McLeod was co-recipient of the Nobel Prize. I think about this all the time. I think, look, what if you just sold the patent for more than $1? Wouldn't all of this be a little easier to swallow? If you had more than $1 to show for your breakthrough, you wouldn't be reliant and at the mercy of these assessment panels for Nobel Prizes or university budgets. You would have much more autonomy over your work and over how you perceive the next discovery, because maybe you could have gone on to do the next discovery. You could have used the money to fund another lab. Demand drives innovation. Money and resources are needed, certainly in the modern day, to provide the fuel and form momentum for innovation. And that fuel for innovation is certainly there for Ozempic. It does not work the same in everybody. Some people taking Ozempic will lose a lot of weight, others may not. There's some call for genomic studies into people where Ozempic doesn't work on them to find out exactly what's going on. Also, as soon as you come off Ozempic, the weight comes back. So it is a life sentence of taking this drug. Not to mention it's an injection, so it's a little fussy. The data around the safety of Ozempic, I think the long-term use and the widespread use of Ozempic will come out pretty soon. I think in 2024, we'll start seeing these studies as the massification, the mass scale prescription of Ozempic becomes a reality, especially as shortages start to wane.